Today's video is a complete, in-depth masterclass on milk expression and how to use a manual breast pump confidently and comfortably. Whether you're a brand new mom feeling overwhelmed, or you've been breastfeeding for a little while and just want better results with pumping, this 50-minute guide is designed to walk you through everything step by step. Grab some water, sit back, and let's talk about how to make pumping simple, effective, and stress-free. First, let's talk about why pumping can feel confusing in the beginning. When you first look at a manual pump, it may seem simple: a handle, a flange, a bottle lid. But when you actually try it, you might wonder, am I doing this right? Why is milk not flowing? Why does it feel uncomfortable? Is this normal? These questions are completely normal. Pumping is a learned skill. It's not about just squeezing a handle, it's about understanding your body, your milk flow, and the rhythm that works best for you. Before we even start pumping, preparation is key. Always begin by washing your hands thoroughly. Make sure all pump parts are clean, dry, and properly assembled. Hygiene is extremely important because breast milk will be fed to your baby. If you sterilize your pump parts regularly and let them air dry completely, you reduce the risk of contamination and keep everything safe. Now let's break down the parts of a manual breast pump so you fully understand what you're working with. The flange is the funnel-shaped part that goes over your breast. The valve and diaphragm create suction. The handle is what you squeeze to generate the pumping motion, and the bottle collects the milk. Understanding each part gives you more control and confidence. One of the biggest mistakes new moms make is not checking flange size. If the flange is too small, it can cause discomfort and reduce milk output. If it's too large, suction may not be effective. Your nipples should move freely in the tunnel without too much rubbing. If pumping feels painful instead of slightly uncomfortable at first, something needs adjusting. Let's talk about mindset. Your body responds strongly to relaxation. If you're stressed, tense, or anxious, milk letdown can slow down. Before pumping, take a few deep breaths. Roll your shoulders. Sit in a comfortable chair with back support. Some moms find it helpful to look at a picture of their baby, hold their baby's blanket, or even pump near their baby. Emotional connection can trigger milk flow faster. Now we're ready to start. Place the flange gently over your breast, making sure it forms a secure seal. Start by squeezing the handle lightly and quickly to mimic a baby's initial fast sucking. This helps stimulate letdown. Don't immediately squeeze hard and slow. Begin with short, gentle pumps for about 30–60 seconds. Once you feel milk starting to flow, shift to a slower, deeper rhythm. Squeeze, hold for a second, release. Find a consistent pace that feels natural. You don't need to rush. Pumping should not feel like a race. A steady rhythm is more effective than random squeezing. If milk doesn't start flowing right away, don't panic. Sometimes it takes a few minutes. You can gently massage your breast before and during pumping. Use your fingers to lightly compress around the breast tissue, moving in circular motions toward the nipple. This helps stimulate milk ducts and increase output. Let's talk about timing. Most pumping sessions last between 15 and 25 minutes per breast. Some moms alternate breasts every few minutes, while others finish one side completely before switching. There's no single correct way. The best method is the one that empties your breast comfortably and efficiently. You might notice that milk flow comes in waves. It may start strong, slow down, then increase again. That's completely normal. When flow slows, try gentle breast compression. Lean slightly forward to help gravity assist the flow. Now let's address discomfort. Pumping should never cause sharp pain. Mild pressure is normal, but pain means something needs adjusting. Check flange placement. Reduce suction strength. Relax your shoulders and jaw. Tension in your body can actually increase discomfort. Hydration plays a huge role in milk production. Make sure you're drinking enough water throughout the day. Eating balanced meals with protein, healthy fats, and whole grains also supports milk supply. Your body needs fuel to produce milk. Let's talk about building a milk supply. Consistency matters more than intensity. Pumping regularly, especially in the early weeks, signals your body to keep producing milk. Skipping sessions frequently can reduce supply over time. If you're exclusively pumping, you may need 8–10 sessions per day in the beginning. For moms returning to work, Planning is key. Try to pump at the same times your baby would normally feed. This keeps your supply aligned with your baby's needs. Store milk properly in clean containers. Label with date and time. Milk storage guidelines are important. Freshly expressed milk can usually stay at room temperature for several hours, in the refrigerator for several days, and in the freezer for longer periods depending on conditions. Always use clean storage bags or bottles designed for breast milk. Now let's discuss cleaning after pumping. Disassemble all parts that come into contact with milk. Wash them in warm soapy water or place them in a sterilizer if available. Let them air dry completely before storing. Proper cleaning prevents bacteria growth and keeps future sessions safe. Some moms struggle with low output and feel discouraged. Remember, pump output is not always equal to your total milk supply. Babies are often more efficient than pumps. If you're concerned about supply, focus on frequent pumping, good hydration, and relaxation techniques. Power pumping is another method some moms use to boost supply. This involves pumping for 20 minutes, resting for 10, pumping again for 10, resting for 10, and pumping for another 10. It mimics cluster feeding and can signal your body to increase production. Night pumping can feel exhausting, but prolactin levels are often higher at night, which can support supply. If possible, maintain at least one nighttime session in the early months. Let's talk about common challenges. Engorgement can make pumping uncomfortable. In this case, apply a warm compress before pumping to help milk flow. After pumping, a cool compress can reduce swelling. Clogged ducts may feel like a tender lump. Gentle massage, frequent pumping, and warm compresses can help relieve them. If you notice redness, fever, or severe pain, consult a healthcare provider. Emotional health is just as important as physical health. Pumping can sometimes feel isolating or overwhelming. Give yourself grace. You're learning, you're adjusting, you're doing your best for your baby. Creating a pumping routine can make life easier. Choose a comfortable spot at home where you feel relaxed. Keep your pump, storage bags, water bottle, and snacks nearby. Make it your little comfort station. Some moms like to watch a show or listen to calming music while pumping. Others use the time to rest quietly. Find what makes you feel peaceful. Tracking your pumping sessions can help you notice patterns. Write down time and amount expressed. This helps you understand your body's rhythm and can reassure you that progress is happening. If you're supplementing with formula, that's okay too. Every feeding journey is different. The goal is a healthy baby and a healthy mom. Pumping is a tool, not a test of success. Let's talk about transitioning. If you plan to reduce pumping sessions, do it gradually. Slowly shorten sessions or increase time between them to avoid engorgement. If you're exclusively breastfeeding and adding pumping occasionally, choose a time when milk supply is naturally higher, often in the morning. Manual pumps have benefits. They are portable, quiet, affordable, and give you full control over suction. Some moms actually find manual pumps more comfortable than electric ones. However, they require hand effort. If your hand gets tired, pause, stretch your fingers, and resume. There's no need to push through discomfort. Over time, you'll notice your body responding faster. Letdown may happen quicker. Output may increase. Confidence will grow. Celebrate small wins. The first ounce, the first full bottle, the first stress-free session. These milestones matter. Remember, comparison steals joy. Every mom's body is different. Some produce more, some less. What matters most is that your baby is growing and you are caring for yourself. As we wrap up this complete pumping masterclass, I want you to remember this: you are capable. Pumping may feel awkward at first, but with patience and consistency, it becomes easier. Trust your body. Learn your rhythm. Stay hydrated. Rest when you can. Thank you so much for spending this time with me. If you found this guide helpful, share it with another mom who might need encouragement. You're not alone on this journey. Keep going, stay confident, and I'll see you in the next video.